In this presentation, we're going to be talking about barriers that may limit access to healthcare services for clients with limited English language proficiency, also referred to as LEP. Let's zoom out and take a look at the interpreter's role within healthcare. As I start this section of the presentation, I want you to step out of the patient's room and out of the clinic or hospital, and instead, I'd like you to think about whole communities. Let's start by defining health equity. First, I want to point out that equity is not the same as equality. Health equity is when all members of society enjoy a fair and just opportunity to be as healthy as possible. Equity doesn't mean each individual or group of people is given the same resources or opportunities. That's equality. Instead, equity recognizes that each person has different circumstances and requires the allocation of the exact resources and opportunities needed to reach an equal outcome. Let's use the pictures in this slide to illustrate the difference between equality and equity. You can see on the left that there are two people who need access to the tree that provides fruit. And while they have been given the same tool to reach the tree, their access to the fruit is still unequal. An equitable solution, on the other hand, pictured on the right, allocates the exact resources, that is, the specific resources that person needs to access the fruit. And this leads to positive outcomes for both individuals. So in order to achieve equity in healthcare, it is necessary to recognize that healthcare outcomes are affected by factors other than genetics and lifestyle choices. To put it in different terms, in addition to genetics and lifestyle choices, other factors, for example, discrimination, occupation, access to healthcare, education, income, housing, access to food, all of these things also impact health and well-being. These factors are collectively referred to as social determinants of health. And based on a lot of research, we know that social determinants of health, also called SDOH, have a major impact on people's health, well-being, and quality of life. The U.S. Department of Health and Human Services defines social determinants of health as the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. The World Health Organization's definition further explains that these circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. So simply put, these are the factors that affect a person's health and make it either easier or harder for people to prioritize the health and wellness of themselves and their family. Now, I'd like you to take a piece of paper and do this activity with me. Feel free to pause the video if you need to get something to write with. Okay, here we have 4 factors that contribute to healthcare outcomes. So based on research, we know they directly affect healthcare outcomes. I'd like you to consider each factor and write down how much each factor contributes to healthcare outcomes. If it helps, picture a person who suffers from chronic migraines. This person gets a migraine on average once every 2 weeks. They decide to see a doctor about their migraines. Now, this person you are picturing can have a good outcome. For example, they can manage their pain and reduce the number of migraines they get, or they can have a bad outcome. For example, their pain gets worse and migraines start to happen more often. Either way, you decide what happens after they have gone to their healthcare provider. Now, what I'd like you to think about is whether this person ends up with a good or bad outcome. How much did the 4 things on this slide influence that person's outcome? How much influence will the person's socioeconomics, things like how much money they earn, their education, the safety in their neighborhood, How much do these things influence their outcome? How much will this person's behavior influence their outcome? Whether they eat healthy foods, they exercise, smoke, or drink? How much will the care they receive from their doctor affect their outcome? And how their physical environment will affect their outcome, so things like air pollution where they live and work, how easy or difficult it is to get to a place that sells healthy foods or to a medical facility. So on your piece of paper, assign a percentage to each. Do they affect health outcomes equally? Does one impact more than the rest? I will give you 30 seconds, but feel free to pause the video if you need more time. Okay, let's take a look at the data. This is data from county health rankings across the country. Starting at the top of the list and shown in blue in the chart, socioeconomic factors contribute to 47% of outcomes. Health behaviors in orange, those are things like whether someone exercises, smokes, drinks. Health behaviors in orange contribute to 34% of outcomes. Physical environment, shown in yellow, 3%, and only 16% of outcomes are attributed to clinical care provided. This means that social determinants of health, as described by the Department of Health and Human Services, are attributed to 50% of health outcomes and only 16% on what happens in a clinical setting. With regard to health behaviors, that's 34% in orange. I would like you to consider that many health behaviors are impacted by social determinants of health. Things like making healthier food choices may be more difficult for someone who lives in a food desert. That is, an area that has limited access to a grocery store or a healthy, affordable retail food outlet. Or someone who lives close to a store, but that store doesn't have many healthy options, and they don't always have a way to get to a supermarket where healthier foods are available. So why should interpreters learn about social determinants of health? I'm going to ask a couple of questions first before I answer this. First, did you know that healthcare providers are in customer service? They are. Doctors, nurses, physical therapists, sonographers all provide a service for a fee. Patients are their customers. Did you know that interpreters are in customer service too? Professional interpreters also render services to consumers of interpreting services. For interpreters working in a healthcare setting, our consumers, meaning our customers, are both the patients and the professionals who deliver healthcare services. Regardless of who pays us, our end customers are providers, also referred to as healthcare providers, and their patients. So back to the question, why should interpreters learn about social determinants of health? In any industry, you must know your customers in order to serve them well. It is part of what you need to learn and know in order to be an effective professional. Learning about social determinants of health, in other words, things that impact health and outcomes, helps interpreters understand the needs of their customers who are patients. And learning about how healthcare providers address them helps interpreters understand the interpreting needs of customers who are providers. In a peer-reviewed article published by the American Medical Association Journal of Ethics, the authors tie this up nicely for us so that we can understand why interpreters play a big role in health equity. Reading from the abstract here on your screen, it says that the use of professional medical interpreters is associated with decreased health disparities for patients with LEP, improved patient comprehension, fewer medical errors, and greater patient and clinician satisfaction compared to use of ad hoc interpreters such as family members or bilingual staff. Federal and state regulations require healthcare organizations to provide trained interpreters for patients with LEP, or limited English proficiency. Patients and families with limited English proficiency, or LEP, face barriers to healthcare service access, experience lower quality care, and suffer worse health outcomes. LEP is an independent driver of health disparities, and it exacerbates other social determinants of health. Disparities due to language are particularly unjust because LEP is morally irrelevant and a source of unfair, unnecessary disadvantage. Clinicians and healthcare organizations have duties to intervene. Okay, so now that we have this information, what do we do with it? This information should be a part of every interpreter's training because it gives you insight into consumers of interpreting services. It helps with understanding the environment in which interpreters work. It helps you understand the role of the interpreter within a healthcare team and the roles of others in order to work together and ensure patients receive the best care their providers can give them. And it helps you understand how important the interpreter's role is as we strive towards equity in healthcare at the local, national, and global level. And it helps with vocabulary. Now, before I move on, I do want to mention something very important. Notice I said interpreting needs. It is very important that we stick to our role as interpreters. The issues and needs we have discussed in this presentation are many and require the expertise of different professionals. Interpreters must remember their scope and practice within the boundaries of the professional interpreter. Okay, so let's talk about how this information helps us with vocabulary. As healthcare experts identify barriers and inequities that directly impact the populations we serve, i.e. the LEP populations, and as they begin to implement strategies to tackle these issues, we also need to be aware of how these strategies are implemented in a clinical setting during patient-provider encounters, which is when interpreters interpret. For example, one strategy to reduce healthcare disparities is to increase access to preventative care services, including screenings, immunizations, and tobacco cessation. Now, this means that we as interpreters need to add this vocabulary and the vocabulary used to actually perform these screenings into our vocabularies, both in English and our language of service. So, do you know how to say screening in your language of service? How about cessation or hemoglobin A1C?